Do you know methotrexate has been used for the treatment of choriocarcinoma, which is the gestational trophoblastic disease? So what is the today topic we are going to discuss? We are going to discuss methotrexate, which belong to anti-metabolic category or classification of the drug. We also have some other drugs like you can see the sub-classification like folate antagonist, purine antagonist, and pyrimidine antagonist, and the name of the drugs has been given. So this is under classification of anti-metabolites, and under sub-classification they are folate antagonists. How they act? The mechanism is very simple. They are responsible to stop the folate synthesis, and how folate synthesis is produced we discussed in our previous lecture as well, that with the help of dihydrofolate reductase is responsible for the synthesis of folate. So what methotrexate is doing, it is actively transported inside the cell, and then it blocks the enzyme dihydrofolate reductase, and by inhibiting the dihydrofolate reductase they inhibiting the synthesis of folic acid or folates. And it is used for the treatment of breast cancer, head or neck cancer, osteogenic sarcoma. What is osteogenic sarcoma? Osteogenic sarcoma is the sarcoma, or in simple word, the cancer of the bone, as if we see the word osteo. So wherever the term come osteo, it means the bone. So genic mean genesis. So the cancer of the bone is explained in terms of osteogenic sarcoma. It is also responsible for affecting primary central nervous system lymphoma, non-Hodgkin lymphoma, bladder carcinoma, as mentioned in the introduction, choriocarcinoma. The toxicity include mucositis, diarrhea, myelosuppression like neutropenia and thrombocytopenia. Long-term use of methotrexate can lead to hepatotoxicity and pulmonary infiltration and fibrosis. It is available under the name Methotrexate, 2.5 milligram, 100 tablets has been available. Let's discuss the one of the case study. They are talking about the use of the bladder cancer, and we already know that for treating the bladder cancer, methotrexate is also one of the drugs. And actually, when we take a look of anti-metabolites, we have a number of drugs they are using for different cancers, especially for the bladder cancer. And we have another drug like gemcitabine, and this is also one of the drug that has been used for the bladder cancer. So I have one case study to discuss. If you read the title of this paper, we have gemcitabine cisplatin. Cisplatin is another classification of the drug that come under miscellaneous drugs. We will discuss them later on. Versus methotrexate, vinblastine, doxorubicin, cisplatin. So actually, this is a comparison of two studies for the treatment of muscle invasive bladder cancer, where we're giving either a drug like G and C, which is gemcitabine and cisplatin, then or the comparison of the treatment with methotrexate that we are discussing in today's topic, plus the combination of other drugs like vinblastine, which belong to the vinca alkaloids. Then they use with doxorubicin and cisplatin as well. So you can see that there is two kind of treatment that we're giving, and we need to see the review on this paper that which one is the better for the treatment of muscle invasive bladder carcinoma. So when they investigate, they found that GC, which is stand for gemcitabine, and we have cisplatin, they're talking about it is having a better response as compared to the multiple drug therapy like methotrexate, vinblastine, then doxorubicin, or then cisplatin. So they after this systematic review, they found that gemcitabine plus cisplatin is better as compared to MVAC, and this was confirmed after the analysis of 13 studies among 2,174 patients. And after the meta-analysis, they have decided that this for the muscle invasive bladder cancer, methotrexate is not as effective even if we use in combination with the other anti-cancer drugs as compared to gemcitabine versus cisplatin. What will be the reason behind the therapy gemcitabine will be better with cisplatin? The answer is in the conclusion. And when I read the conclusion, they're talking about that gemcitabine versus cisplatin, when we use in combination in that category, they decrease the risk of grade 3 and grade 4 neutropenia, mucositis, and febrile neutropenia. So what they're talking about, the adverse effects are less as compared to the other therapies that we are giving. So that in that context, they are talking about the beneficial effect of this therapy in bladder cancer. So thank you so much for today's lecture. Hope to see you again.